Hi, rectal bleeding. It's very common. Usually, most of the time, it's nothing to be concerned about. Usually it's from internal or external hemorrhoids. You may have an anal fissure, an irritation with your anal canal. But what's important here is that rectal bleeding can be a sign of something more serious further up. You may have polyps. You may have inflammatory bowel disease like ulcerative colitis or Crohn's or other autoimmune diseases. You may also have polyps or colon cancer, for example, also gives rectal bleeding. If you have rectal bleeding after the age of 40, okay, even if you have hemorrhoids or an anal fissure, most likely you should have a colonoscopy to make sure that there's nothing more serious further up. Because chronic inflammatory bowel disease or tumors, for example, can lead to an increase in your intracolonic pressure and cause hemorrhoidal bleeding, or it can cause anal fissures. So just because you've diagnosed the hemorrhoid or the fissure, it doesn't mean that there's nothing further up. But if there's no other warning symptoms, for example, you haven't lost weight, your stools are not dark, there's no family history of colon cancer or inflammatory bowel disease, simple treatment with diet manipulation, sometimes with local analgesics and creams, your symptoms most likely will go away. Lifestyle modification always is important. A high fiber, bulking diet, don't smoke, stay away from alcohol, be careful with medications like with aspirin or other non-steroidal anti-inflammatory medications. But if your symptoms persist, or if they go away with treatment and they recur, most likely you should have a colonoscopy to make sure that there's nothing more important further up. Always have a blood test to make sure that your hemoglobin and your iron counts are normal. Because if they're low, once again, it's most likely secondary to something further up. Thank you.